With inferior glide, the main one that I think of a lot of times is abduction, right? Because as you abduct, that humerus needs to glide inferior. So, I'll start out right here. If I'm in this open pack position here, in all reality, get my cell phone out. So if this is my treatment plane, remember it goes lateral and then some anterior and superior. If this is my treatment plane and I want to do an inferior glide, I could actually pull the humerus this way and this would be inferior, correct? Convex on concave, that makes sense. However, if I move his shoulder out to this position, since it's a convex on concave, my shoulder the mob has to still go the same direction. It doesn't change with convex on concave. Okay? So what that means, and the reason I tell you guys that, is if I'm in an open pack position, I want to do an inferior glide, in reality I'm just kind of doing this traction out this way. Right? I'm just kind of tractioning out. I can maybe put pressure here on around coracoid and clavicle to kind of hold that scapula down and do traction. Okay. So, that being said, if someone is lacking abduction, abduction, they're lacking this motion here, eventually, as a clinician, I'm going to want to try to get that motion back. And the way I'm going to do that is bring them closer into this position where they're having difficulty, right? So I find closer to in range and then do my inferior glide. So I want you guys to first be aware that you could do an inferior glide this way, by kind of doing a distraction here if you were in this open pack position. But if you move away from this open pack position to, say, somewhere in here, right, then my inferior glide still needs to go the same direction, but now I can't just pull out and distract. I can't pull this way because that's a different thing, right? So what I like to do is kind of support him here. Let me raise this table up just a little bit. Okay. So I like to support him here. Find the acromion again, and do my mob out this way. So I'll get on his humerus, do my mob in this way. Okay? So my force is going out like this. I'm pushing kind of through the heel of my hand as I do this. If you move them up too high, remember that the shoulder, you need to allow it to externally rotate it, so don't internally rotate it or else you get that impingement. Right now I'm kind of keeping him in sort of an externally rotated position. I'm getting lined up like this, putting my hand in here, and like this. Okay, so right there I was probably doing about a grade 2, if we want to get into it. So here's R1, I'm just coming back and forth like this. We go further, doing a grade 3, or 4 at the very end. You guys don't need to worry about that. I just wanted you to kind of see that. Okay? So, let's let you guys practice.